Hello, everyone, and welcome to this Zoom meeting from ACET Uganda.
I'm Naomi, and this is Mbale. This is one of the communities served by ACET Uganda. As you can see, there is sunshine today. It's been raining, but today we are enjoying a warm sunshine.
And I am the regional manager at ACET Mbale. Just to give you a little bit of a background, as a country, Uganda is more used to pandemics than you may be in the West. We have lived through the HIV/AIDS pandemic in Uganda, which so far has affected 1.5 million people, killed over 55,000 people, and devastated families and the economy. We have been used to being tested and traced for HIV. So when COVID appeared in our country and lockdown was imposed, our people were more able to respond to the restrictions. And of course, these were enforced by the police. Now, I'm aware that COVID-19 has hit harder in your country than it has in my country. And I just want you to know that our prayers and sympathies are with you. And so every day we do pray for you. ACET was founded in, was established in the UK in 1989 by Dr. Patrick Dixon as a response to the AIDS epidemic. Over the years, ACET has spread to many countries around the world to support people living with HIV and AIDS and to promote sexual health and education. ACET Uganda was founded in 1990. We work with the government, work with non-government organizations and communities throughout the country, offering capacity building for the church and other civil society organizations. We also do education support and training. We do prevention and care, psychosocial support for orphans and vulnerable children, and economic empowerment through village savings and loan associations. ACET Mbale, where I work, specializes in youth interventions, offering young people life skills training in assertiveness and positive life choices. Over the years, we have partnered with a number of organizations, including Tiafan and St. James Church. Now, Uganda does have a young population as a country, and we know that girls are young at first sexual experience and first pregnancy. This is reported to actually occur below the age of 15 years. As a consequence of lockdown in the city and the rural communities, the teenage pregnancy and distressingly defilement has increased dramatically. And we are questioning ourselves as to how this happened. Now, here is just two examples of the media reporting of the crisis from our local TV and news. You can see there some numbers of cases that have been reported per district, but this has actually now increased from what we are seeing in this presentation. As ACET has considered the problem, we think there are at least 4 major factors to this, one of which is a high prevalence of gender-based violence, where more cases of rape and defilement have been reported during the lockdown. We actually have over 21,000 cases reported so far. The other factor is parental and family negligence, where we are seeing parents becoming absentee parents. They're not there for their children, and actually some children have been abandoned to their elderly grandparents. The other factor is poverty driving decision-making. We see girls being enticed by older men into sex in exchange for gifts and money. Lastly, is a lack of sexual health education in the communities. And so this is what ACET Mbale is embarking on doing. We are working with individuals and communities and institutions to educate girls on how to resist sexual pressure. We are also influencing communities in their attitude and responsibilities towards protecting girls. And we are also providing peer and social support to young people in their communities. And in the near future, we intend to work with government on policy. This is just one of the stories of the teenage girls, of what's happening around them. They are deceived, impregnated, abandoned by their families, and some are unfortunately forced into marriages. So this is just this girl, 14 years old, who has been impregnated, and as I speak now, her education future is completely shattered. ACET Mbale is using our core skills and expertise to deliver training programs to young people and other key stakeholders. Our experienced team at ACET is working with local community volunteers to deliver these programs using well-established ACET methods. We are adapting the use of Facebook and Zoom in addition to our traditional face-to-face training methods. We have been able to reach 309 young women and men since mid-March. And so just to know, we are making some progress. And this is the dedicated ACET Mbale team who is undertaking the work that we are doing. We are a small but powerful team. We have been able to establish a peer-to-peer program in the target communities where 31 young people, particularly leaders, have been selected and trained in specific sexual health information and life skills. A health promotion program has been started through which the trained young people are able to regularly interface with their peers to share accurate health information about preventing teenage pregnancy. Now, we all know that a young person's peer group has a strong influence on their behavior. So peer education is an approach that makes use of peer influence in a positive way. Meet some of the pioneer peer educators who've been recently trained and are already active in their communities and churches. They meet with their peers every week on Sunday and are able to pass on healthy messages regarding prevention of teenage pregnancy. As you can see, some of the messages they were able to coin on their cards that they are able to generate discussions with their peers. So some of the promotional messages, or I can call them written commitments by the young people, include messages such as, I am not ready for fatherhood, I am not ready for motherhood, then resist and prevent, then say no to teenage pregnancy, and then the other messages, the choice is mine, not hormones. And then one young person wrote, I choose books, not babies. So they go about using these messages to generate healthy conversations with their peers. We have been keen to start this program of work to respond to the crisis. And of course, to undertake this new program, we need to raise some new money. We know that the entire program over a period of 15 to 18 months will take about £23,000. But to start the priority programs for 3 months, we have been able to raise about £3,700, and we believe this is a good starting point. From mid-March, we have been able to train 31 young people, most of whom are girls, in peer education. And we have also been able to reach 309 girls and boys through the peer-to-peer program. 10 youth clubs in the target communities will be formed in the coming weeks. As we are able to raise more money, we'll continue to expand the program to the full range of activities planned. But if not, we will have made a substantial impact for these 3 months. And I just want to thank you for your interest in this project. And if you have interest in supporting this project, perhaps you could consider telling your friends and pass on the presentation material or arrange a presentation for a group. And so thank you so much for making time to listen to me. And maybe just for you to know that we'll be making regular updates to provide you with regular information on the progress of the project. And so we'll keep doing this either through Zoom updates or through flyers. Should we raise more money? This is what we will be keen to do in the second quarter. So we believe that in the second quarter, we'll be able to reach 1,500 girls through the life skills program on assertiveness, self-esteem, and decision-making. We will also be able to reach 1,400 girls and boys through the sexual reproductive health program, and also 2,000 girls and boys through educative health film shows. As mentioned earlier, as we are able to raise more money, we'll continue to expand the full range of activities planned. So thank you so much for your time, and I'm really grateful.